Did you know that 1 in 4 seniors falls each year? And falls are the leading cause of injury among older adults. Now, the good news is you can do something about it. With the right steps, you can prevent these falls. So stay tuned because today I'm sharing practical, actionable tips that will help you stay steady, safe, and confident as you age. Hello, everyone. I'm Dr. Adelita Hamis, your lifestyle and wellness doctor coach, is specializing in senior health and the prevention of chronic diseases. So today, we will talk about something that affects so many older adults, no matter where you are in the world. Falls and injuries, and more importantly, how you can prevent them so you don't have to live in fear of falling. There are simple ways to protect yourself and continue confidently enjoying your golden years. So make sure you watch until the end because I'm not just sharing the how-to. I've also got some surprising facts and tips that might change how you think about safety. Now let's start with the facts, okay? Here's another surprising fact. Did you know that every 11 seconds, an older adult is treated in an emergency room for a fall-related injury? That's huge, right? Falls are the leading cause of hip fractures and other serious injuries, and the consequences can go beyond the physical. In fact, a single fall can lead to a fear of falling. And that fear often limits your ability to stay active. But here's one thing. It doesn't have to be that way. Okay? Now, first question I have is, what makes seniors more prone to falls? As we age, our bodies change, we know that. Vision, hearing, balance, muscle strength, and these all decline. And these factors can increase your risk of falling. Chronic conditions like diabetes or arthritis can also affect your coordination. Now, don't worry, you can take control by focusing on specific steps to reduce your risk. But let's remember the impact of medications too. Some can make you feel dizzy or drowsy, increasing your risk of falling. In my experience, I've seen some seniors still taking Benadryl, for example, to help them sleep, but that has a side effect. Confusion, balancing, drowsiness, these can be adverse effects. So there are medications, okay? Now let's talk about key steps to prevent falls. Number 1, keep moving. Keep moving. Sounds like a contradiction, right? If you're going to keep the senior adult moving, she's going to be at risk of falling. Well, it turns out it's not completely true. Exercise is your best defense here. Simple activities like walking, like yoga, and even Tai Chi are fantastic for improving strength and balance. So here's my tip. Did you know that practicing Tai Chi can reduce the risk of falls by as much as, guess what? The number is 55%. You heard that right. 55% reduced risk of falls by Tai Chi. It's a gentle yet effective way to improve balance and coordination. Perfect for seniors. Second step to reduce your risk of falls, declutter your environment. Your home should be your haven, okay? But sometimes it's full of what? Hidden dangers. What are these? Walkways. Walkways can be cluttered with things like rugs or cords or furniture that you might trip over. So make sure your hallways are clean and no clutter. Think about your bathroom. Bathroom is one of the most common sites of fall for seniors. Grab bars near the toilet and in the shower can make a difference. Make sure you have that too. It's this little changes that can reduce your fall risk significantly. So my tip is consider getting a non-slip rug in your bathroom if you really need so, or in the kitchen. Make sure it's a non-slip rug. Trust me, it's worth the small investment. Now, number three step in reducing your risk of fall, light it up. Light it up. Good lighting is so important, especially for seniors. So if you wake up in the middle of the night, you don't want to stumble around in the dark, right? So put some night lights in the hallways, bathrooms, and bedrooms. These can provide an extra visibility to help you move safely. So my tip, use motion sensor lights for extra convenience. You don't have to worry about turning the light off or on, when you have to use them or not use them. Just use the motion sensor lights. Now, fourth step, check your eyes and your ears. Did you know that vision changes can cause difficulty judging distance or depth? That's a big deal when it comes to stairs or navigating uneven surfaces, okay? So make sure, my tip, get your eyes checked regularly. And if you wear glasses, consider talking to your optometrist about alternatives to bifocals for better depth perception. And when you're wearing glasses, make sure you're also checking in with your optometrist every year. Okay? Fifth step to reducing your risk of falls, wear the right shoes. You wouldn't wear sandals to a hike, right? No. The same goes for your daily footwear. Choose shoes with sturdy soles and support. So my tip, avoid slippers or flip-flops with smooth soles. They offer little to no support and can be a major tripping hazard. Okay? Now, our next goal for this talk is understanding the role of health. We've dealt with the mechanical aspect, right? Make sure that you're not missing out on the medical side. Most seniors are on a bunch of medications. So make sure you've checked your medications with your doctor or healthcare provider, because certain medications can cause dizziness and drowsiness, making you more prone to falls. So have your medications reviewed regularly by your doctor. Make sure you understand what the adverse effects or side effects are of those medications you're taking. Ask your doctor if any of those medications have side effects like dizziness and drowsiness, and see if they have alternatives. Or maybe reduce the dose. Maybe take it at the time when you're not active physically. Another thing you want to look at, nutrition. Nutrition matters, my friends. Your bones are your body's foundation. Keeping them strong is essential, especially as you get older. So make sure your foods are naturally rich with calcium and vitamin D. These are the key players in bone health. Here's a fact. Did you know that women over 50 and men over 70 need at least 1,200 milligrams of calcium every day? So make sure you're getting enough through your diet. I strongly recommend getting it from your diet or from food naturally rich with calcium and not from the supplements. Here's another tip. Stay hydrated. Do not underestimate hydration. Dehydration is often overlooked, but it can lead to dizziness and imbalance for seniors. So aim if you can, drink 8 cups of water a day, unless your doctor recommends otherwise. My tip: if you struggle to drink enough water like me, try adding some lemon or cucumber to your water for a refreshing twist. And here's what I personally do, because I'm not a water drinker, but I know I need to. So I eat my water. What does that mean? Think about fruits. Fruits have a lot of water content. So I make sure I incorporate that in my diet. So then I drink basically the water from it. All right? Now, I know that a fall can be scary, but don't let it stop you from moving and enjoying life. Because the more you stay active, the stronger and more confident you become. If you've had a fall in the past, it's normal to feel a bit more cautious. But don't let that fear take over. Start small with balance exercise, and you gain back that confidence in no time. Now, let's hear from you. What's one step you're going to take today to reduce your fall risk? Maybe it's clearing a walkway in the house. Maybe it's wearing better shoes or adding a nightlight. Motion sensor. Don't forget that, okay? And let me know in the comments below. I'd love to hear how you're staying safe. And if you found this video helpful, give it a thumbs up, share it with someone you care, and don't forget to subscribe for more tips on healthy aging. Remember, staying safe from falls isn't just about avoiding accidents. It's about staying strong, active, and independent. Keep making those small changes, and you feel more confident and safe as you age. Thanks for watching, and until next time, stay safe and stay well. Bye!